Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine Posture and Chiropractic Clinic. I am here with my lovely lady, Gabby, and just basically picking her brain as someone who came to the office not knowing what to expect and someone who'd been to other offices before, so stay tuned. All right, let's talk to Gabby. I'm just gonna ask questions and just kind of for people who are exploring what's out there. Gabby, you've been coming here for how long?
Oh, time flies when you're having fun. Put it that way. A couple months now.
Okay.
And I've seen more improvement working with you than I have 6 months to a year working with any other doctors.
Okay, so what are any other doctors? What are they, chiropractors?
I saw chiropractors, I saw orthopedists, I saw 2 other different chiropractors as well.
Physical therapists?
Yeah.
Okay. So what was going on with you? What were you seeing?
I had pain in my hip and also on the inside of my knee. I was weightlifting and just couldn't get the right muscles to fire up and just kept getting pain on the outside of my hip.
And historically, you're active?
I'm very active, played soccer in college, also played softball growing up. I've always been, fit, fairly fit.
So just FYI, a lot of our videos, Gabby does a great job doing it. So we actually videotape Gabby for a lot of videos that we put out there, especially on Instagram, I think. Yeah, on Instagram. She's famous on Instagram. Can you share with whoever's looking at this video from your extent of people that you've gone to for fairly common problems that people go to chiropractors, physical therapists essentially. How is it that this office is different from all the other ones that you've been to?
So this office really has tried to get down to the root cause instead of just trying to throw random exercises at me just to see what sticks. No one could really identify what was wrong. And here, it's quite simple. A lot of us stabilizer muscles are not playing a role, and it's helped me tremendously trying to get those stabilizer muscles to work properly.
So when you started coming here, did you feel like, oh, this is why did you even pick this office if you've been to other chiropractors?
I really liked your website.
All right,
your website spoke to me. A lot of the issues that you said you treated on your website really resonated with me. And so I just figured, why not give it a try? Fair
enough. And now, one of the things that I hope to get out of you saying to the video is how I'm not into isolating an area and stretching it or strengthening a
You treat the whole body.
The whole body.
Yes.
So that's such a like a fad, a holistic approach, but really, what is your understanding of what we do? How would you explain it to someone who doesn't know about the way we do things? How are the exercises different than the other exercises? There are plenty of exercises out there.
The exercises here don't focus on one muscle, or say you have pain in your hip, so we're not just focusing on the hip, we're focusing on other extremities that could lead to the hip and stabilizing those.
So is it true to say that we basically work out the whole body and the parts that are a problem area get to be stretched if they're tight, strengthened if they're weak, and they get to really play with the rest of the body?
I'd say that's true. It's really working out functionally, how you should do functional movements, your everyday movements, what they should look like, instead of just pump an iron.
Right, exactly. Now, just for the record, you work from home?
Yes.
And how many hours a day would you say you work behind a computer?
7 to 8 hours a day. I work in IT, so.
So So this is a typical situation. Do you find the exercises here? Do we use any weights or anything?
No, it's all just my body weight. And I mean, I like to lay down a mat, so I'm not laying on a hardwood floor in my apartment. And I can do these exercises. I can get up from my desk at any time, do a couple, exercises, and then get back to work.
Do you find, so you don't need to go to the gym to do any of these exercises? No weights, bands, or?
Nope, it's just helpful to have a yoga mat.
And do you find the exercises challenging?
Yes. Oh, I wore a sweatshirt coming in here. I had to take it off because I was sweating after one move.
One move.
Yeah.
So just for the record, these moves that we're talking about are moves that babies do.
Mm-hmm.
So they're proper ways of moving around. So for your body that's used to maybe a part that's hurting and the rest of the body picks up the tab, essentially, we make sure that each body part do their own part while we're moving. Do you have any recommendation to people who are watching this video and they're wondering, I don't know, do you think that what we do, you would have been able to do it on your own before coming here?
Oh, no. Because pointing out little cues, sometimes you think you're doing something right, but then, it's helpful to have somebody else watching you and giving you verbal or physical cues, like touching in a certain spot where you should flatten out or engage a muscle is extremely helpful.
How is what we do different than, let's say, a personal trainer?
You're paying attention to me.
Well, there are plenty of personal trainers too. The issue here is not even every chiropractor does the DNS, dynamic neuromuscular stabilization, or postural neurology for that matter. So do you think that going forward with how much exposure you've gotten to movement, and I have to say, just for the record, Gabby is definitely more advanced than an average patient that comes here. She's very attentive. We call that her cortical connection is really good, meaning if I say do this, the brain knows automatically how to do it correctly quite often. So she's more advanced in that regard, and she's just a strong person. But do you think that someone who can pump more weight automatically is going to be able to do these easier, or is it relevant?
I think that, they're going to struggle in different ways. I think, if you work out regularly and you are more fit, you are more in tune to your body. So you'll be able to listen to cues that you're giving. Unless
you're just working out just because you want to work out and you don't pay attention, which we have plenty of people who do that.
I think that's the most important thing, is paying attention. The fact that you're paying attention to me and that I'm paying attention to what you're telling me and focusing only on the task at hand.
So how much of your daily time would you say you spend on doing these exercises when you're not here?
When I'm working and sitting at a desk, I try to take a break every 30 minutes to an hour. Of course, it's really difficult for people who really like to just, I want to get this work done. But if you set a timer or you sit on a ball, that forces you to get up because you get fidgety. Just take that, couple minutes to lay down and do a couple exercises and then get back to work.
So you mentioned the ball. The ball has to do with postural neurology. So do you think that from your exposure here, you better understand movement and how you should be going forward? Do you feel that you're educated enough, or you just know how to do these exercises?
No, I definitely feel like I'm getting more of an education on how my body works. If you just sit in a chair and you're just in front of the computer all day, you kind of forget about your body and you're all in your head. Whereas if you're sitting on a ball, you're moving and it's like, oh wait, my back hurts. Oh wait, my knee hurts. Oh, maybe I should probably get up.
So I'm going to put you on the spot here. How are you becoming more aware of being on a ball?
Because you're moving.
Because what does that movement do? We'll go one step further. Where does it end? The movement happens because it's unstable surface. How does an unstable surface help you become more aware? The cue is activating the
barrel.
Brain.
Oh, brain.
So when you sit on an uneven surface, the brain's constantly trying to balance you.
Right.
And it activates the PMRF, the portion of the brain that says upright against gravity. So your communication from the brain, the command center, to the rest of your body, it's constantly trying to balance you. So you become more aware of your presence instead of totally ignoring how everything is. So it's not so much to make you aware of aches and pains, it's to balance you better. When you're balancing better, you'll notice a lot of times we revert into what we're used to doing. So we want to break that pattern, and that's how we break the pattern. This is incorporating postural neurology into something that's daily routine. Do you think that what happens here with the education that goes along what we do, do you think that you're becoming more attentive? Do you think that attentive to how you do things?
Oh, mindfulness. It's all about mindfulness and paying attention to how you're moving. Even when I'm washing dishes, I'm paying attention to where my neck is and not hovering over the sink, and making sure I'm sitting up straight. And even when I bend down to get something out of the oven when I'm cooking, I'm trying to squat more or just
so every daily routine things becomes an opportunity for workout, and that's what it is. This is how we injure ourselves. How many people do we know that say, oh, I just bent down to brush my teeth and my back went out? It's like, well, that toothbrush wasn't that heavy. Right? So it's just over time.
Right.
That's about it. Is there anything else you want to share, or is there something that you think people should know?
It's fun. It doesn't feel like a chore, and it's challenging, but you can feel the progress. At least, you know, an ex-athlete who's been to doctor after doctor with no solution, this has been a blessing, so thank you.
All right, well, thank you. Well, I hope that if you're looking into, I feel like if you're looking into really enjoying life, because, you know, if just a simple moving around is painful or restrictive, it's kind of not fun. So that's the solution, either here or somewhere else. The purpose of doing this video is not to have you come here, even though I think I'm freaking awesome, but it's really, you need to understand what the answer to your problem is, and then you find a place where it can provide you that. And it's not so you go there for the rest of your life. It's so you gain the knowledge, understand how to tackle the problem on your own. And, you know, every once in a while, if you need a little extra help, by all means, you go for it. But that's the whole purpose. Don't waste your time looking for the wrong answer, because there are plenty of them out there, right? Thanks for watching. Make sure you subscribe to my YouTube channel and check out my website. All the information will be in the description box. You take care.